I will be talking about how to leverage pediatric primary care to promote early childhood well-being. I'm not going to talk so much about specific research, but kind of a project initiative that I think will create a great kind of platform for research. So I should tell you a little bit about myself. In addition to being a mental health services researcher, I'm also a pediatric nurse practitioner. I provide primary care to children at one of Boston's neighborhood health centers. And I'm sure for those who have young children or have family members, you know that children see pediatric clinicians very often during their first 2 years of life. It's up to 10 routine visits in the first 2 years. And these visits are nearly universal. They're non-stigmatizing, and they provide opportunities for bigenerational care. They're also a great platform for research due to the potential for scalability and sustainability, particularly as the scope of reimbursement for primary care preventive visits has expanded. So I'd like to introduce TeamUp as a platform to conduct early childhood research. TeamUp is an 8-year foundation-funded initiative that seeks to build the capacity of community health centers to deliver high-quality, evidence-informed, integrated behavioral health care to children and families. And has a really strong focus on early childhood. And this slide presents the brief overview of the key components of the model. The basic model augments primary care with teams of behavioral health clinicians and community health workers to meet the developmental and behavioral needs of children and families. And it begins with universal prevention, with screening for material needs and child development using the survey of well-being of young children, and also includes a newborn touch prevention visit. The next step involves treatment for early childhood concerns in primary care. In our work, we found a lack of brief interventions that were suitable for deployment in primary care settings. So we engaged experts in early childhood and developed something we call BRANCH, which is building resilience and nurturing young children. And some of you here, I think Ruth was very involved in helping us develop this. And it's the centerpiece of early childhood treatment for the model. And it has three phases focused on family engagement, assessment of trauma and child social emotional development, and planning for next steps. And it can be delivered flexibly within primary care setting in about 3 to 5 sessions. The next step in our model, it links to specialty care, which are generally off-site, and those include early intervention services, in-depth developmental evaluations, and linkages to more intensive early childhood focused therapies like child-parent psychotherapy. TeamUp is gathering a lot of data, and it's coming from electronic health records. So it's we're getting it on a really large group of children. The screening results are individual item level data, and we have that about for material needs, as well as data from the SWIC, which gathers information about child behavior, development, and family concerns. And we found that about 30% of parents report developmental concerns and 20% social emotional concerns in the population of children screened. We've also developed tools to gather role-specific data about clinical services and decision-making. I don't know how well you can see the behavioral health clinician plan, but these plans are completed at each intervention, each interaction, and document the presenting issues, what clinicians did, their education, treatment, referrals, and care coordination. These data provide us rich opportunities for further investigations of early childhood well-being among diverse children who live in structurally marginalized communities. These are some of the plausible, possible issues that TeamUp data could explore, and can read through them. And these are opportunities for collaboration, which we would really welcome. And I'd just like to thank the other leaders of TeamUp, Megan Bear-Merrick, Chris Sheldrick, Anita Morris, and Michelle Durham, and also our funding from the Smith and Smith Family and Klarman Foundations. Thank you.